My name is Julie, but everybody calls me Jules. I've had a cochlear implant for about 4.5 years, and I'm a hairdresser and I have my own business and I'm quite busy. I'm very busy. I work 6 days a week.
My name is Sami. I am 48 years old. I'm a personal trainer. I'm a mum to an almost 17-year-old daughter, and I am a dog mum to 3 little rescue dogs.
My name is Dr. Philip Chang, and I've been involved with cochlear implantation for more than 20 years. Cochlear implant care now has to be seamless, particularly between the surgeon in the OR and the audiologist in the clinic. Cochlear Connected Care has turned hearing implant care on its head. Never before, with implant surgery, have we had real-time data in that critical part of the surgery when the implant is being inserted. SmartNav now does that. We were involved in the usability trial of SmartNav, and what I can say is that this is a quantum leap forward for surgeon and patient outcomes.
My name is Mohammad. I have been working as a cochlear implant audiologist for the past 10 years. I always introduce remote care technology to my patients, especially if they live regionally or they have an active and busy lifestyle.
I live in a rural area. I'm 5 hours away from my audiologist, so being able to access remote care is just perfect for my lifestyle.
When I first heard about remote care, I was a little bit apprehensive, hoping that I could manage it, but it was so easy to use, there was nothing to worry about.
The key benefits of remote care for me are I don't need to take time out of my life to travel to see my audiologist. I can get an appointment when I need it. It's quick, it's easy to use, and it's more care, really. I see it as more care, another level of care.
Remote check is one of the best technologies that we are using consistently. It will allow us to monitor the patient performance and how they are doing in a daily basis.
Mohammad suggested that I use remote check because it helps him to monitor me without me having to run down there into the clinic. It actually gives you the confidence to know that your clinician is actually following up and following your progress.
I love that with remote check, when I do my questionnaire and I do my activities, that Mohammad can see where I'm at, and if there's something wrong, he's going to let me know. I will use remote check again and again and again because it saves me time and I can fit it into my busy day. Remote assist sessions differ from an in-clinic appointment. You're seeing your audiologist on the phone rather than face-to-face, but apart from that, there's not that much difference.
Even in face-to-face, we don't change the programs a lot. Sometimes the patients will be stable. It's just doing little fine-tunings if we need to.
When Mohammad makes the changes on my processor, I can go out, chat to my husband and see what they sound like, and then go back to Mohammad and report straight back to him.
In my opinion, remote assist is exactly the same as attending the clinic. You get asked the same questions, you give the same feedback, and it is so simple you feel like you're actually in the clinic.
I love remote care, it just works for me.